the shoulders. After the winter green, we're going to do the VitaFlex thumb roll on the back. This is done like we did on the feet, except for we're using our thumbs. And I come to the top of the table to do this. Offset my thumbs so that they're on either side of the spine, and then rest my hands lightly on the back. And again, it's all the way over, as we did on the feet, and then pull all the way back. All the way over, and all the way back. When I go all the way over, my thumbnail and first knuckle are flat against the spine, and then pull all the way back. All the way over, all the way back. You can practice this on the thighs of your legs to get this motion. Do the neck also. And it's 3 times. Next. The marker, since it's so nice for the muscles and helps muscles relax, we're going to place it on the sides of the back. 6 to 10 drops, and also up the spine. And then we feather it so that it's spread all over the back. And then the same feathering technique right up the spine. The full length of the spine after the 6 and 12-inch sections, full length, and then fanning up and off. 3 times in each section. And then starting at the bottom of the back, up and off the shoulders. After the margin, we're going to do a circular massage. This is done by using the palms of my hands, resting my fingers lightly on the back. And I'm on the side of the back here. I like to lock my thumbs, it's more comfortable for me, and circle clockwise again 3 times, and then move up. So it's 3 times, and move up, and 3 more times clockwise. We are going to alternate side to side, again on this modality. So 3 times clockwise. Sometimes when you trade sides, it's you need to remember that it's clockwise on both sides. I find that a lot of times this is so relaxing for the person on the table that often they'll go to sleep while you're doing this. Aromases is next. And we apply the aromases just like we did the marjoram. On the sides of the back. Eight to 10 drops, feathering, so that we can spread this all over the back. And then 16 sections again. To me, when I'm doing Raindrop, it becomes like a beautiful dance as we do the 1, 2, and 3. 1, 2, 3, and 1, 2, 3. Up and off the shoulders 3 times now. Okay, after the aromases, we do the palm slide. This is done by placing both hands on the bottom of the back here, and one hand slides past the other one. So you slide this way, this way, this way. When you get this movement, it's really good if you can just swing those hips as a facilitator. Peppermint. With the peppermint, we're going to place it right on the spine, 3 to 5 drops. Peppermint can be very cooling. And 6-inch sections with feathering strokes. 12-inch sections. Full length of the spine. And then the fanning. And the full length of the back, up and off of the shoulders 3 times. Valor. We're going to finish up the back with a valor. We started with valor on the feet and valor on the back. So on the sides of the back and up the spine, 8 to 10 drops with light feathering strokes to cover the back. And then 6-inch sections with 1, 2, 3, and 1, 2, 3, 1, 2, 3. 12-inch sections. And then the full length of the spine. And fanning up and off the back. 3 times in each section, moving up with 1, 2, 3, and 1, 2, 3. Full length of the spine and off of the shoulders. Okay, after the valor, we're going to use some ortho beads. Just a little bit in the palm of my hand there. And we're just depending on your situation, the time, do a nice little massage, a little back rub at the end here with the Ortho Ease. And we're going to ask the receiver to turn over. We're going to finish with the brainstem pump. This is done by cupping her head in my hands. So I'm going to curl my hands right underneath that bone, you know, the occipital bone, the bottom of the head there, and I'm curling my fingers. The thumbs are rested lightly in front of her ears, and then I'm just bending my fingers, pulling her whole body toward me. Not toward the ceiling, but toward me. I'm going to do this for 1 minute, and then I'm going to rest 1 minute and continue with 1 more minute. Her whole body's moving toward me, you might notice. And so it's not my arms or my hands, but strictly my fingers that are making this movement. So my fingers, if you can see them here, this is what they're looking like underneath her head. They're going, you know, bend, 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 bend with my fingers. Okay? Okay, we're going to complete this raindrop by placing one Angelica now across the facilitator's shoulders. Okay, how do you feel? Oh, that's good. Perfect, she says. Can't get better than that, can we? Okay, thank you.
Question.
Yes, just when, we'll take some questions in just a moment here. As you get your raindrop kits, and you look at the DVD, it's going to be a little bit differently. You know, as Gary Young teaches, he's quite intuitive, and so often when he teaches, he'll maybe read the body a little bit and do just a little bit different things. And the DVD is going to be a little bit different. About 6 years ago, we had 20 distributors come to Ecuador to make the raindrop more standardized throughout the world. Okay, and so that's what I get to teach. It's called the official version now, okay, of the raindrop, and I'm always enjoy teaching and sharing this with you. And so that's why the DVD, or different times you may have seen it, might be a little bit different than tonight, but that's when this raindrop was standardized. So after giving and receiving a raindrop, it's very, very important to drink a lot of water. These oils are very powerful. When I first started using the oils, I thought, gosh, a little bit is good, but certainly much better, but that's not true in oils. They're very powerful oils. And so I usually use the less number of oils than more number of oils with this, but they're still release toxins in our body, and so it's very, very important to drink a lot of water, both as a facilitator and a receiver. Okay, we have a few questions, so let's go with the questions now.
Okay, during the brainstem pump, I failed to catch what oil you were using.
I wasn't using an oil.
No oil. It was
No, I just turned them over and did it.
Okay.
Yes.
Second, how soon afterwards can the receiver take a shower?
You know, it depends on the preference of the receiver. I personally like to get all of the benefit I possibly can and leave them on as long as I can. However, some people, if they're going out right then, might not want to smell like a pizza or you know, whatever you might smell like. And so with the oils, the beautiful thing is they're volatile, and so they flash off quickly, and they also absorb very quickly into the body. And so you're going to still get a lot of effect even if you shower not too long after you have the raindrop.
Last question.
Yes.
For a receiver who would be more sensitive than most, is it okay to outrightly mix the V6 with the oils immediately?
To mix the B6?
Yes.
As you do each oil?
Yes.
As a
If, for example, the receiver is sensitive.
right. And
they
you know what?
immediately feel heat.
Right, that is okay. In fact, in the UK, you know, different countries have different legislations, of course, and in the UK, you have to put B6 on the back before you use any of the oils. And that's how we do Raindrop in the UK. So it is okay to use a B6. They'll still get the benefit. Okay? Needs the best way, you know, straight on is the word. Okay, question?
Hi, good evening. You mentioned that they have different standards in the UK. I read that aromatherapy in the UK, you're not allowed to use wintergreen.
Not allowed to use
Wintergreen oil.
wintergreen.
I
I know that in the past the birch oil is not used, but I've never heard of not using wintergreen. I've used it. Yes.
Second question. As the facilitator, you mentioned, well, as facilitator and the receiver, the oils are very powerful. Is there a number that, for example, if you're the facilitator, is there a maximum number of patients that you can do it to? Because every time you do it to a certain patient, you keep on receiving the oils. Is there like once a day, and then the next therapist can do the next patient?
So as a facilitator or a therapist, the question is how many times could I do Raindrop in a day? And I know Gary Young's done, I don't know how many in a day, maybe up to 20 at the, you know, it just depends on your body and how you are, if you're very sensitive to the oils. I've done probably 10 oils in a day, or 10 raindrops in a day at the clinic when we were really busy at some point. And so just see how your body's reacting to it. I never ever had a reaction to any of it. I just was enjoying all those oils every time I get one, and the opportunity to work on a person. You know, whenever I touch a person's body, I consider that a very sacred honor to have them allow me as a facilitator and trust me into their space. And so whenever I touch somebody's body, whether it's your family member or whoever it is, you know, always have that respect and honor toward that person that you're working with. Okay.
Any more questions?
Right up here.
How long will she benefit from this raindrop?
How long? It's been set about 7 days, actually. But often we give them at the clinic twice a week. But 7 days is the normal answer for that.
Can a 13-year-old boy get a raindrop technique? Is he too young? Is there an age?
No, a 13-year-old is not too young to have raindrop technique. In fact, I've used raindrop technique on small children and even, you know, on babies. The way obviously on some small children, you're not going to be able to do all of these massage techniques. If I was working on a baby, I'd put 1 drop of oregano, for instance, in my hand with a lot of carrier oil and just rub it in my hand and work that up their little spine or on the bottom of their feet particularly. And so, yes, you can.
What about those who have skin asthma?
Now that you have to take precautions with, okay? And some people may actually get a rash with raindrop, not very often. But one thing you may ask the client, the person that you're working with, receiver, is if they've been around a lot of chemicals. Because if they have been around a lot of chemicals, then that's when they're most likely maybe to have a rash. And so what I would use if they're very sensitive is just cut down the amount of oil. In fact, I've even used just 1 drop of each oil sometimes with people like this, and so that they can still receive the benefit without having the problem maybe. Okay?
I have some more questions.
Great.
Because some of the drops you put them on the spines and some of them you put on the sides of the body. Is there a difference?
You know, the ones that we work on the side, the ones that are working in the spine and on the sides, you know, it depends on whether we want it to go on, spread into the muscles and the tissues more, that's all.
Maybe last one, which is, if the back is all red, does it mean the toxins are coming out? Or
If the back's all red, it could mean that toxins are coming out. It could also mean, you know, that that is a stress area in their back that needs some attention.
thank you.
You're welcome, thank you.
Question.
Hi, good evening, Tamara. I'd like to ask, being a facilitator, after doing the process, how long or should we wash hands right away or do something like applying basics of it to cleanse self up?
That's a good question also. As I mentioned, as a facilitator, sometimes if you're not used to these oils on your hands, they can be a little irritating or burning. And so during the process, you can put V6 on them. And after the raindrop, I just wash them with soap and water. Okay? Between each raindrop, I usually just go, you know, just as if you were doing a massage or other body work, you know, go clean yourself that way. Okay?
All right.
Yes.
Yeah, how about, can we use the raindrop for people who had cervical operations? I don't know, spinal, I should say, spinal operations or spinal injury. Can we do that on them?
Yes, you can. Now, it depends on the which situation they're in, how soon it is after the surgery. You'll have to be, you know, maybe cautious with some of these massage modalities that we use. But you can, you know, feather lightly the oils on the spine and maybe not use so much of the massage modalities right after, okay?
But we do not do it reverse from the top because we do it from the bottom upwards. Are we not going to do it from the top downwards?
Now we do, that's a good question. You know, the further classes in Raindrop, we teach if you have like MS or neurological problems, then we do start from the neck and work down, rather than from the sacrum and work up. Okay? We do the feet the same way, but we start from the neck here and work down. Okay? But not necessarily with surgeries, okay?
Thank you.
You're welcome.
I'm sorry, another question.
That's fine.
I remember before you started the technique, demonstrating the technique, you sensed the energy in the patient's or the volunteer's body. If you feel more heat in another part of the body, do you alter the technique in any way, or do you still use the same technique?
I do the same thing. And what I didn't do is afterward, before I turn them over, I like to check their spine again and then feel where the heat is, and almost always it's changed. You know, it's cooled off.
So the heat in the body means that there's something that's stuck in that area.
Possibly.
Thank
It
you.
can mean quite a few things. Thank you. Another thing that I have not mentioned, we usually don't do raindrop with particularly the first trimester of pregnancy. You know, you just need to take precautions with pregnancy, with pregnant women to do raindrop, okay?
Excuse me, we were late, no, but I don't know if this is relevant. I've used the oils. I used it daily. Does it have, I had an effect of itchiness in my body. I was told that I had an overdose. Is it possible? What you said you were doing is just that is only for once a week. I did it daily. Does it have any effect?
I'm not sure I understand the question. Can you help me, Karen?
Yeah, she uses the oils daily, and then there was an itchiness and irritation with it.
Yeah.
And
Various oils.
she used various oils. So she's asking if
Overdose.
there's such a thing as an overdose of usage of oils.
Oh, an overdose of essential oils. You know, it depends on your body and how it's releasing the toxins in your body. At the clinic, we use a lot of oils on the patients, even internally, rectal implants, etc. So they're getting pretty well saturated with the oils. And so my personal opinion, okay, is that no, you cannot. Okay, just, you know, continue drinking lots of water, and if you do get irritation, then use a carrier oil. But it's important, no matter when you use oils, to drink a lot of water, because they are very powerful and they do release toxins in your body. Okay, Sam?
Yeah, it will be helpful also if you do a cleanse, you know, because
It's just cleansing.
Yes.
It's a cleansing. Okay.
Yes, a lot of times at the clinic, you know, people have skin irritations with the oils. It's because they need to clean their liver and the colon. That's a whole other class though, okay? And there's great products to do that with Young Living. Okay, other questions, other oils, right here.
Hi. My question is, usually you don't, it's not recommended to massage people who have cancer or concerns on blood diseases. Can you apply the raindrop if it's not without, if it is without the harder parts of the massage?
Yes.
Yes. Yes.
Yes, just you need maybe to take precautions, and if you're in a situation where they need to get permission from their doctor, then that's a good precaution to take too. But as I mentioned at the clinic, we did this on all the patients. Okay?
Okay.
Thank you.
thank you. Any more? Excuse me. I'd like to ask, since we are mostly applying on the spinal part of the body,
Yes.
will the carrier oil ortho-ease be better than V6?
The V6 is just carrier oil. It's like sweet almond oil. And the Ortho-Ease has essential oils in it. It has you know, some basil, some eucalyptus, 2 different kinds of eucalyptus in it, lavender, and different oils in the Ortho-Ease. And so the Ortho-Ease is a wonderful massage oil with a little bit of essential oils in it. And so if the person has some, is uncomfortable because of the burning with oregano and thyme, for instance, then the V6 is the better choice to have the cooling effect. Okay, does that answer that? Okay, thank you. Another question up here?
Your raindrop kit, the one that comes in the small bottles,
Yes.
like how many uses are, you know,
Are in that.
are in it?
And obviously that depends on the drops that you're using. Like I said, I like to use the lesser amount rather than the larger amount, as I mentioned. But it will probably do up to 8, I'd say, 6 to 8.
Patients or 8 people?
Yes, 8 people.
And someone wanted to ask if there is alcohol consumption. For example, he's drinking red wine, and then will the oils be, is it not a good time to use the oils when someone is under alcohol?
I've never had that question. I would say probably not. You know, probably do it when you're both clear.
Okay.
Okay.
In cases of management, I'm Dr. Salvador. In case of management of post-epileptic condition, post-stroke, do you recommend an earlier management in the use of the Raindrop technique? Or would you rather delay it until patients would recover some muscle strength? Or how early do you recommend using the rainbow massage treatment? Raindrop,
That's okay, a lot of people call it rainbow. It's beautiful like the rainbow.
Because I've seen patients that there are doctors who are not in favor of managing with the massage in the early stages of a post-apoplectic condition. But there are those doctors in another school of thought who would prefer a much earlier, and some would delay it until some muscle strength are recovered. How do you, what is your, comment on this? Or how often do you start the raindrop therapy?
What is the can you say that again, the condition?
Post-apoplectic, post-stroke, it's the name of, after a stroke. Post-stroke.
Oh, stroke. Thank you, I'm sorry. I wasn't
Apoplectic stroke.
catching that. No, that would depend, I think, as you work with their facilitator as a doctor. Personally, I think it would be great just as soon after stroke as you could.
So as early as possible?
Yes.
Okay.
Thank you.
Because in one institution where I came from, the University of Santa Cruz,
Yes.
the method of is the same as what you said, an early exposure to massage.
Right, you might start off with just a few drops of oils, less oils or more, and see how they are affected.
So you apply this in a global technique? Because you said in the UK you adopt certain methods.
In the UK, they just have to use the V6.
Okay.
Okay, before they apply the oils.
So the technique now is universally accepted in the way you demonstrated it?
The same.
Okay.
Okay.
Can we do the raindrop technique with the receiver sitting down or just leaning instead of lying flat?
I have. At the clinic, sometimes we had people that weren't able for some reason to lie on the table. And so we had a massage chair, and it's a little bit more difficult to do some of the movements and the techniques, but I've done that often. Yes, so you can.
How about, have you tried, can we do raindrop on a person who has epilepsy, because basil is not good for epilepsy, or have you heard anything about that?
I would be cautious with that and maybe just eliminate the basil.
Oh, okay.
And use, anytime you have a situation like this, I always start off with maybe just 2 drops of each oil instead of the amount that we're using, and see how that person reacts. Okay?
Okay.
Hi again. If you don't have like a massage bed, if
Yes.
you're in the house, would you advise the person who's being massaged to lay flat on their face, or can they turn their head to the side, or will
Yes,
it
it is a little awkward. Obviously, the best thing is to have a bed, a massage table. But yes, you can either, have them adjust and let them stretch their neck. Sometimes I've had them just put their head so it's just off the end of the bed here with their chin right here. And then, work with them as they move maybe this side, and then a little bit later have them move to the other side so that their neck's getting kinked up. It's the best thing if you can keep them straight, though, for the movement and the structural alignment that we're seeking in the raindrop. Okay.
Okay, I guess that's it.
Oh,
one
another
more.
question.
Excuse me. What is the best suggestion for persons with sensitive skin problems?
Less oil and a lot of B6. And, some of us with light skin, we are a little bit more sensitive to the oils. And so just use less oil and more B6 oil. Okay?
Can we ask her how she feels now? Or, yeah? Can we get the effect of what she was
Yes, that'd be great. Thank you.
Yes, as I said a while ago, I feel perfect. But during the first, when they were doing my feet, gases are coming out. It's coming out like.
I didn't hear it.
You didn't hear that? I can feel it. It's so.
It's a lot of movement there, releasing the toxins.
No.
That's a great way to release toxins, yes.
Oh, that's the toxin coming out.
It is, yes.
Yeah, gases. It's a form
Yes.
of gases. And now I feel so. This is a little bit hot on my.
A little bit warm there?
Yeah.
Okay.
But it's fine. I like the feeling.
You said you almost went to sleep on the table.
I know.
You must have felt relaxed.
I was trying to hold it because I might snore. And so it's embarrassing. I might be snoring.
Oh, I've had a lot of people snore, so.
There was time, so he was going to snore.
Yeah, so that's it. I'm perfect. I've been wanting to have Raindrop, this therapy, since I learned about it. I'm looking forward to better, to more raindrop.
Thank you. Well, it's certainly been my, another question? Okay.
You need to drink a lot of water.
How can you be certified to facilitate raindrop technique?
No, the certification for Raindrop doesn't come through Young Living right now. It depends on each country that you live in and their legislation. You know, whether you can do Raindrop without it. Most countries, you know, to do it as a practice to charge money, then you need probably a massage license or some type of a therapist license or, you know, a degree in that manner. Okay?
Okay.
Okay. And so
So
that's why we're
there's
teaching.
no like certifying institution as long as you, like for example, if you're a physical therapist or you get a license, like for example, if you want to practice this in US, so there's no like one body that would certify you as a facilitator. As long as you're, because I'm a physical therapist, so I'm okay already. I can
Yes.
apply it.
Yes, if you're a physical therapist, then you'd be covered with that licensing.
Okay.
If I'm a massage therapist in the US, then I'd be covered by that license also. Our doctor, you know, whatever like that. There is a program in the US that gives continuing education hours for the Raindrop and certification that way. And so that's why it's so fun to teach the introduction to Raindrop, because it lets people know that you don't necessarily have to be a massage therapist to do the Raindrop, that you can share these oils for the well-being of your family and your friends. Okay? So I suggest that you go home and practice. I've hardly ever ran into a person that I've asked if they wanted me to give them a Raindrop. I've never had anyone say no. Everyone has wanted, you know, to experiences that I've experienced, you know, a nice back rub massage, and like I say, it's fantastic for the overall well-being, both emotionally, physically, and spiritually of our bodies, and it builds up the immune system and helps our bodies energetically get into balance. So have fun with it. It's been my pleasure to be here with you in the Philippines. Thank you for having me.
Thank you, Dr. Thank you so much.
You know, I really loved your questions. You know, they were very interesting and you seem to be very keen on continuing to practice Raindrop. Listen to what Tamara said. You really should practice it because if you saw it now,